guys, welcome back to Medical Coding with Blue. Today's episode is all about which medical coding credential is for me. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, all right. So we're going to talk about these medical coding credentials again because I've been getting a lot of questions about Blue. I'm an entry-level medical coder. Which medical coding certifications should I sit for? Sometimes people will go all the way through their program and then they're asking this question. If you are starting a medical billing and coding program, you should be deciding now which certification you're going to be sitting for, because it's going to make the process of going through school a little bit easier, because you're going to know where you need to concentrate on, right? Or what subjects or what type of coding, right? So there are two major medical coding associations. There's the American Health Information Management Association and the American Academy of Professional Coders. The American Health Information Management Association has the gold standard of medical coding credentials. That is the CCS. That is a Certified Coding Specialist. This credential says that you have mastered inpatient coding and outpatient coding, that you know how to code with the ICD-10 PCS book, as well as the CPT book, as well as the ICD-10 CM book. But it says that you understand the fundamentals of inpatient coding and outpatient coding, and that you've essentially mastered it. It is a 4-hour exam, but this one credential says that you can basically go anywhere. You can apply for inpatient positions or outpatient positions, and everybody wants it. If you look in the job listings, you will see that 98.999% of the time, yes, I said 98, 98% of the time, they're asking for this credential because this is a very rigorous exam. They're all rigorous exams, right? But this one has to be the most rigorous one. And this one says that you know a lot, because you have to know a lot in order to pass this test. You can look at the pass-fail rates on the AHIMA website to be able to see that in numbers. Yes, so, but that's if you've taken inpatient and outpatient coding, okay? Now there's the CCA. That is the Certified Coding Associate. This is the entry-level medical coding certification. But this says that you understand, again, inpatient coding and outpatient coding. Now, before anyone says anything, I will delete any comments that are disparaging to the CCA. Only because a lot of people don't understand what the CCA is and what it says, okay? So what the CCA says is this, that this person has the entry-level competency to know inpatient coding and outpatient coding, that you understand ICD-10 CM and ICD-10 PCS. You can go anywhere with the CCA. But this again says that you are brand new. This is a 2-hour exam. This one exam has the most domains of all of the medical coding certification exams, because there are 6 domains. So it is a very tough exam. Compared also to the CCS. The CCS has the 4 domains, but the CCA has 6 domains. So again, it's a very rigorous exam. It's nothing to, think, oh, this is an easier test. It is not. And for those that think that, oh, CCAs can't do anything, I had the CCA for 13 years. And I did a lot with it. I trained doctors, I trained nurses, I trained other medical coders, I trained ancillary staff. I've done a lot with the CCA. Now, if AHIMA would have let me, I'd still have the CCA today. But they, anytime you get a credential that is the next level, like the CCS-P or the CCS, they will, the CCA is superseded. So it's put to bed, because they're saying that you have a higher level credential. Now again, CCA can do anything, inpatient or outpatient. So if you choose to go this route, that's totally fine. There are people that do look for this credential. A lot of people will say, well, I don't see anybody asking for it. You're probably not looking at the right job title, because when I look for it, I see them asked for all the time. So that's a difference there. And there's going to be people out there who think that they know when they speak about the CCA, but they don't know. Because if you do know, then you would know that a lot of people ask for it, and that it is in demand, but it just says it's your entry level. That's all it says. And again, I had it for 13 years because I stubbornly held on to it. I could have had it, taken away a long time ago, but I didn't, because I wanted people to see what a CCA was capable of. And I did. And so, if you want to get the CCA, that is totally fine. Again, it says that you can code for inpatient or outpatient. All right. And the next one is the CCSP, and that is a Certified Coding Specialist, physician-based. This says that you have mastered outpatient coding, that you know how to use the ICD-10-CM manual, the diagnosis manual, the CPT manual, and the HCPCS Level 2 manual. These are your 3 manuals that you need for the CCSP. Now, again, you can apply anywhere, but that says that you know outpatient coding. It doesn't say that you know inpatient coding. You may know inpatient coding. You may understand ICD-10 PCS. But if you really just want to be in the outpatient setting and you don't want to take a test that has inpatient coding in it, then you might want to go with the CCSP. People still ask for it anyway, okay? So it is looked for a lot in the industry. Again, this says that you know outpatient coding, all right? So with that said, none of the AHIMA credentials, the CCS, the CCA, the CCSP, none of these have an apprentice status, just so you guys know. None of them have an apprentice status. So if you take your test and you pass your test, you will walk out of there with your CCS or your CCA or your CCSP, okay? And you're able to go anywhere. Well, with what I said, right? But you're able to do what it is that you want to do with those. So there's no waiting period. There's none of those types of things. You get your credential in full when you leave there, once you pass your certification exam. And AHIMA does have their tests administered at a third-party testing site called Pearson VUE. And it's just a third-party testing site, and they have a bunch of different tests that they administer there to different professions, but medical coding being one of them. So that's just something that you ought to know. But your results, unless they are in a beta period, which right now I don't think anybody's in a beta period, but unless they are in a beta period, you will get your results right away. If they are in a beta period, then you do have to wait. And you can find that out on the AHIMA website. But like I said, I don't think anybody's in a beta period right now that I've looked, okay? But that's just for AHIMA, okay? So that we're clear. If you want to sit for inpatient and outpatient, it's the CCS or the CCA you're after, okay? If it's just outpatient coding that you're comfortable with, then it's the CCSP if you are wanting to go with AHIMA, okay? If you want to go with AAPC, the American Academy of Professional Coders, they have their flagship credential, the CPC, right? The Certified Professional Coder. Now, if you have no experience at all in medical coding, you will have an apprentice status attached to your name, to the credential, when you first get it, when you pass your certification exam. Now, what the apprentice status means on this is that you, again, have less than 2 years of experience. But AAPC, because they are a for-profit organization, they do have a way for you to hurry up and get this 2-year waiting period down to nothing. If you go through an approved AAPC program, plus you go through PractiCode, which is it is an educational product. It is a collection of 600 plus records, right? That have been real world redacted records that have all the PHI taken out of them. And then you go through and you code all of those. That is what AAPC considers 1 year of work experience. This is not 1 year of work experience that you can put on your resume. This is education. It is not work experience for your resume. Now, there's people that mistakenly put that out there, and then they wonder why people don't call them. Employers know. They are not dumb. They know what PractiCode is. PractiCode is an educational product. I do resume rewrites all the time. And whenever somebody who's gone through PractiCode comes to me and they ask about that, I always put it under education, okay? It is never 1 year of work experience, and it is never listed as an internship either. because these employers, they know what Practicode is. So with the CPC, if you want to sit for the CPC, if you go through their approved program, if you go through Practicode, you can totally bypass the apprentice status. But if you go through like the self-paced program and you get Practicode and you do all that, and you go through just a program or you do self-study and then you get Practicode counts for 1 year of the 2-year time commitment. So your 2 years is down to 1 year. And so once you start working, that you work a whole year, then you can apply to have that apprentice status taken off, okay? But if you choose not to, if you choose to study on your own and you want to go with AAPC and you don't want to buy Practicode, that is totally fine. It's 2 years. You can still get a job with the apprentice status, guys. I know because I write resumes again, and they've been able to get jobs even with the apprentice status. It's all in how you present yourself. Okay, I'm just saying that part. But if you go through all of these things and you pass your exam, that says that CPC says that outpatient coding. Again, that ICD-10-CM, CPT, and HCPCS. Those are the 3 books that you need to have in order to sit for that exam. So, to recap, if you're going through your program and they're only teaching you outpatient coding, you have your choice between the CCSP and the CPC. Okay? So you pick whichever association you want to go through. Now, even if your program says we are training you for the CPC, and then you pay for your membership and all that stuff, so that way you can sit for your certification exam, you can still have a choice of going with the AHIMA. You don't necessarily have to go through AAPC, okay? Because they're just saying that this curriculum is training you for the curriculum based on the CPC. But the CPC, again, is covering outpatient coding. So the CCS-P, you can certainly sit for that. You can see all of the domains on the AHIMA website, and you'll be able to see what it is that you need to particularly study. But the study guide for the CPC can definitely help you for the CCSP, all right? And the difference between going with AAPC and going with AHIMA is that with AAPC, you have to pay for your membership dues every single year. And again, they're a for-profit organization, so you have to pay the $205 every single year. Not only that, you have 2 years to come up with 36 continuing education units for 1 certification. With AHIMA, you would only need to come up with 20 CEUs for 1 certification on the medical coding credential side, okay? Just so you know, I'm not talking about the degree designations. I'm talking about the medical coding certifications. It is 20 for 1, okay? And there is no requirement to be a member of AHIMA, okay? But if you choose not to be a member, they will charge you a separate fee for reporting your CEUs. But that separate fee does not come out to $410 that AAPC charges for their members to just be a member, just to have their certification. If you do not pay your certification fee, your membership fee, they will take your credential away from you, okay? And AHIMA does not have that, okay? They will charge you separately to report your CEUs if you are not a member. But again, there's no requirement to have a membership, okay? Now, there's pluses and minuses to being a member of both associations, like either one. You don't have to be a member of both, but there's pluses and minuses, obviously, to it. It is good as far as like being able to make connections in the industry. Both of them have their job bank, right, that you have access to as a member. So, you can think of that as a plus. Both of them offer in their membership dues, both of them offer free CEUs, or CEUs are included because it's not technically free, but it's CEUs are included, some of them, okay, not all of them, but that you would need for your certification. But there are some free ones. So it does kind of help in a way. And again, you get access to all those other things and the membership meetings and things like that. So there's a lot of benefits if you want to become a member. But yes, so If you decide to do AAPC, that's totally fine. You know, people have different reasons why they want to do AAPC as their certification holder, but employers will welcome you with either the CCS, CCA, CCS-P, or the CPC. And again, all you need is one. And when you think of in terms of, well, I'm an entry-level medical coder, you really have to get that entry-level thought out of your head, because when it comes to medical coding, all of these certification exams are difficult. And they're difficult because they need to be able to test your competency, all right? Because what you're about to embark on is quite important. So with that said, you want to make sure that you understand that there is no easy certification. Number one, there is no easy certification. There is not one certification that makes you better just because you have it, okay? And I will say, because I had the CCA, that I have made more than people with multiple credentials. I have made more than nurses. I have made more than degree holders with the CCA. So your credential has nothing to do with your earning power. That has to do with your knowledge. And that's how I was able to get more money, because I knew more, because I studied more, because I applied myself more. That's why I made more money, not the amount of credentials that I had. Again, for 13 years, all I had was one certification, just one. Now I carry the two. I have the CCS-P and the CCS, and only because I got the CCS-P first, and then I got the CCS at the end of the year, because I knew I have some things going on in the background that was the reason that I had to get the CCS-P first. And then I knew I needed time to study for that inpatient side of the house coding, right? The PCS, because I had never coded on the inpatient side before. And because of that, you know, I wanted to make sure that I had the time to study. And I did. I gave myself the time to study. I got my certification for the CCSP in March of 2021. And then I got my CCS in November of 2021. So I got them both in the same year. And yes, I am going to keep them both. But again, I have 15 years of experience now. So there's a difference between myself and somebody else who's brand new. If you are brand new, all you need is one. There is no reason that you need to have a string of credentials when you still have a Cpc-A, or when you have less than 2 years of experience and maybe a CPC, okay? There is no reason to have that many. Well, Bleu, I want to get more educated. Yes, you can totally get more educated, and I understand that, and I admire that. However, the more money that you spend, you are not going to get more money based on having more credentials. You won't. People will say that because they're trying to sell credentials. Think about that, guys, right? And again, if I was able to outrun all these people who had multiple credentials on their name, even degree holders, even nurses and all this other stuff, I was still able to outrun them on that. What makes you think just because you get a whole string of credentials that it's going to make you more money? All it's going to do is make you spend more money. So what I have always recommended is to have the one credential. If you're brand new, have the one credential for the first 2 years. So that way you can fully immerse yourself into learning the field, not just trying to sit here and rack up all these credentials so you can keep up with the Joneses. Because at the end of the day, that's money out of their pocket when they're spending all that money to keep up with all those credentials, right? And at the end of the day, I would like to keep my money because I worked for it. I don't want to have to give it to an association constantly and in such high numbers because I want to keep up with the Joneses. I don't care what other people think about my credentials. I don't. I didn't care back then, and I don't care now. What I care about is myself and my knowledge base. That's what I care about, right? And so, again, I would encourage you that if you're brand new, just get the one so that you can concentrate on the one. You can concentrate on learning the field. Then, when you want to advance and you're thinking, hey, I would like to do CDI. Just for example, let's just say CDI. Because CDI, the CDI credentials, the CDI-P or the CCDS, the CCDSO, those credentials have nothing to do with medical coding, the medical coding credentials. Nothing. On those exams, you don't even need medical code, the manuals, the ICD-10-CM manual, the CPT, or the HCPCS. You do not need those for the CDI exams, okay? That's how different it is versus the medical coding certifications. So think very carefully when you start adding on, because you'll go through some sticker shock when you see all of the amounts of the fees, the money, the CEUs, and they have to be certain CEUs by certain vendors. AAPC is one for that because they have those specialty credentials. Again, look in the job listings, see who's asking for those, and you'll see that they're not asked for. Okay, a lot of the other little specialty credentials that they have, right? So when you look and you see that, okay, now AAPC is asking for the certain specialty credentials that you can only go through certain vendors to meet the CEU requirements. So you can find a bunch of free CEUs, but if they do not meet the requirements for those specialty CEUs, when you get the specialty credentials, see, that's when you have to think about that. I'm just saying, guys, be smart. This is your money. You have to protect it. Don't go and just believe everybody just because they say, well, if you have a bunch of credentials, you're going to get hired faster. You're going to make more money than the person who has only one. Trust me, I know that's a big fat lie. I'm just saying. But beware. Be aware, guys. Be aware. And just take care of yourselves. And especially when it comes to your education. Get educated, yes. But only get the additional credentials if it means something to your organization, if for your particular hospital or whatever, if they're asking for it. Now, sometimes the employer will say, well, we'll pay for it. If that's the case, then by all means, go ahead. Take full advantage of that because that's free education. That's not something that's coming out of your pocket. But if it's coming out of your pocket, guys, be careful. Look at what you're getting. Look at what you're buying and make sure that it's going to benefit you in some way and not just vanity saying, oh, I have all of these credentials. Because at the end of the day, the only thing that people care about is, can you answer these questions? Can you answer these coding questions? Are you good at your craft? No one cares that you have a bunch of credentials. They care if you know, and they care about your knowledge base. I'm just saying. So, with that said, I'm going to go ahead and wrap this one up. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.